Glenn, starting with you, these new case numbers do not grant city or county officials any restrictive power because the governor's open up orders supersede them. But should they? Should the city and county leaders have authority over the governor on health issues like these?
Well, let me say somebody should have that and somebody should do it. And I guess we're going to, in the meanwhile, we're going to have to take responsibility ourselves. You know, I think Governor Abbott gets this upside down when he tells people that they have a right to liberty to not wear a mask. They do not have a right to brandish a weapon or point a weapon at me. It's other people that get sick when they don't wear masks, not themselves. It protects other people. And to say it's okay to threaten other people with disease and death seems upside down to me. If Abbott's not going to do it, locals may have to do it. And if Abbott wants to sue them to stop them, let him sue to spread disease in Texas and see how the courts deal with it.
Ma'am Makoviak, do you think the governor and his advisors are contemplating bringing back restrictions, or is it still too soon to tell?
I don't think they're looking at bringing back restrictions. I think what you might see is them slow down the reopening, moving to additional phases. I do think this is going to put a real pause on any efforts to have large gatherings in the near or medium term. Look, Austin and Houston are among 8 or 10 cities across the country where you are seeing some outbreaks in a second wave, and that is concerning. I mean, that is absolutely concerning. What the reasons for that, I think we're not really quite yet sure. Could be the reopening. It could be from the protests that have occurred, which have been large numbers of people in close proximity. It could just be that in Texas, we've been testing everyone in our nursing homes and a large share of the people in prison. And it could be capturing people who've had COVID but weren't being tested. Certainly, we have more cases because we're doing more testing. And that's absolutely part of this as well. But look, you put your finger on the right issue, and that is hospitalizations, right? And so this arbitrary number of 20 hospitalizations a day, which I know Mayor Adler points to, the issue there is whether our hospitals are going to become overrun. And, you know, right now you're able to do other procedures. It's possible if things continue to trend the way they do that we may not have elective procedures. We may have to go back to that restriction. So we'll see where it goes from here. But no, I don't think county officials should be able to override the governor. You know, this virus does not pay attention to city lines or county lines, and people are traveling across those lines.
All right. Glenn Smith, the Texas economy is essentially opened up. How easy would it be to put that genie back in the bottle?
Well, I do agree that it would be difficult, and that's why I say really in the end it's going to be up to all of us as individuals to care for one another and protect one another. I don't think the governor's, I'm kind of with Matt, I don't think he's going to change anything because I don't think he cares. Let me add one thing to it. You know, the testing and contact tracing depend upon keeping the caseload at a certain number. So now we've reached numbers in our urban area which makes those two safeguards against spread of the disease almost moot, meaning we have no choice but to social distance, wear masks, wash our hands regularly. If we're not going to be ordered to do it, we have to do it on our own to protect the lives and health of those we know and love.
All right, Matt Makoviak, real quickly, do you think it's confusing for Texans right now? They get one direction from the governor, another from local officials?
Could be, certainly, and it would be ideal to have everyone working off, you know, the same sheet of music right now. And so, look, I think better coordination, you know, would be part of it. I do think there may be some political agendas, perhaps in both directions. You know, the governor wants to reopen the economy, wants to save jobs as much as possible. The county officials in the urban areas are really putting public health first and really want to see these shutdowns continue. Right. You know, there has to be a middle pathway, and I think ultimately people have to do the right thing. I agree with Glenn. Wear a mask if you can't social distance. You should be social distancing. You should be washing your hands.
Good advice.